Do you feel unexplained tingling? Do you experience fatigue even after a good night's sleep? These symptoms might seem harmless, but they could be hiding something very serious: multiple sclerosis. This neurological, autoimmune, and progressive disease can begin with subtle signs that many people ignore for years, until the damage becomes irreversible. In today's video, we're going to reveal the 10 early symptoms of multiple sclerosis that almost no one knows, but that can change your life if detected in time. Pay close attention, because symptom number 7 is often mistaken for stress, and may be your body's first warning. Subscribe and hit the bell for health tips. Multiple sclerosis is an autoimmune disease in which the immune system attacks the myelin, the protective layer of the nerves in the brain and spinal cord. This causes inflammation and compromises communication between the brain and the body. Symptoms vary from person to person, but the pattern is clear. The earlier it is detected, the greater the chances of controlling its progression and maintaining quality of life. The problem is that many early signs are subtle, intermittent, or attributed to other causes. That's why it's essential to know the early signs and consult a neurologist when you notice any combination of them. 1. Tingling and numbness in arms, legs, or face. Tingling or numbness in parts of the body is one of the first neurological signs of multiple sclerosis. It may begin mildly, like a body part feels asleep or as if being pricked by needles. This symptom occurs because inflammation in the nervous system prevents electrical signals from correctly reaching the muscles and skin. It usually affects one side of the body or specific areas like the hands, feet, or face. If you experience frequent numbness without an obvious cause like poor circulation or bad posture, it's time to investigate. 2. Extreme and constant fatigue, even without physical effort. Feeling tired after a busy day is normal. But when fatigue becomes chronic, intense, and doesn't improve with rest, it can be a worrying sign. MS-related fatigue is different. It is disabling, comes on for no clear reason, and can last all day. This exhaustion is caused by neurological dysfunctions and increased energy demand from the brain to perform simple tasks. Many people confuse it with depression, burnout, or anemia, which is why this sign often goes unnoticed in the early stages. 3. Blurred vision, double vision, or pain when moving the eyes. Visual problems are also among the first symptoms of multiple sclerosis. This happens because the optic nerve may be one of the first targets of inflammation. The person may notice blurry vision, double vision, or even temporary vision loss in one eye. Another sign is eye pain when moving the eyes, caused by optic neuritis. These episodes can last days or weeks with partial or full recovery, but they are a serious red flag that must be urgently evaluated by an ophthalmologist and a neurologist. 4. Balance and motor coordination problems. Tripping often, feeling like the ground is unstable, or losing coordination may seem like simple clumsiness. But with MS, this happens because the parts of the brain that control balance and muscles are being affected. Many people notice they can no longer walk in a straight line, do activities that were once easy, or experience unexplained falls. This symptom can progress to difficulty walking or climbing stairs if not properly treated from the beginning. 5. Muscle spasms and stiffness. Involuntary spasms, muscle stiffness, or sudden contractions are also early symptoms of multiple sclerosis. These spasms occur because the nerve signals controlling the muscles are interrupted or distorted, causing involuntary movements. Sometimes a person feels their legs stiffen out of nowhere, or experiences a sensation of the muscle locking up. This is known as spasticity and can cause pain, discomfort, and difficulty moving. Often this symptom is mistaken for orthopedic problems, but it's actually the central nervous system being affected. 6. Memory, focus, and reasoning problems. Multiple sclerosis can also affect cognition. A person may start forgetting names, appointments, lose focus easily, or have trouble organizing thoughts. This is called brain fog. These symptoms are common but often attributed to stress or aging. However, in MS patients, these changes are caused by inflammation in brain connections, especially in areas responsible for memory and reasoning. Even if they're mild at first, it's important to track and note the frequency of these episodes. 7. Bladder and bowel changes. Bladder and bowel control may be affected by MS even in its early stages. This happens because the nerves controlling these organs can be damaged, resulting in urinary urgency, incontinence, trouble emptying the bladder, or constipation. Sometimes the person doesn't realize these problems are related to the nervous system and assumes it's a urinary infection or poor diet. If you experience changes in these areas and other symptoms are also present, don't ignore them. 8. Pain and strange sensations in the body. MS can cause unexplained pain, burning sensations, electric shocks, or a tightness around the body, especially the torso, known as the MS hug. These pains are caused by damage to sensory nerves, not by muscle injuries. That's why they're persistent and often don't respond to common painkillers. This symptom can be very uncomfortable and may affect sleep and mood. If you feel these sensations frequently for no clear reason, seek medical advice right away. 9. Depression, anxiety, and mood swings. Although these symptoms are also linked to emotional factors, they are often a direct consequence of MS. Brain inflammation can interfere with neurotransmitter production and balance, leading to sudden depression, anxiety attacks, irritability, or even euphoria. These changes can be confusing for both the patient and their family. It's crucial to pay attention to emotional health and understand that it can also be an early sign of something more serious. Psychological support and a proper diagnosis are vital in this process. 10. Sexual dysfunction without medical explanation. MS can affect sexual function in both men and women, mainly due to nerve damage in that area. Symptoms include reduced libido, difficulty getting aroused, pain during intercourse, or erectile dysfunction. Since it's a sensitive topic, many people avoid reporting this symptom, which delays diagnosis even further. However, it's an important sign that the nervous system may be compromised and should be openly discussed with a healthcare professional. Multiple sclerosis is a serious disease, but it can be controlled if diagnosed early. Recognizing the first signs is essential to start treatment and prevent the disease from permanently affecting your quality of life. If you've noticed 2 or more of these symptoms in yourself or someone close to you, don't ignore them. See a neurologist, get specific tests, and fight for an accurate diagnosis. Information saves lives, and the more you know about your body, the more tools you'll have to protect it. If this video helped you, leave a like, share it with your friends and family, and subscribe to the channel so you don't miss more content on health, silent symptoms, and quality of life. Remember, sometimes the body whispers before it screams. Listen to the signs. See you in the next video.